What if I told you the blood pressure number your doctor said was just fine might actually be putting you at risk? And what if that other number, the one that made them rush for the prescription pad, was actually pretty normal for someone your age? I know that sounds backwards, but after spending over 2 decades helping folks over 60 manage their blood pressure, here's what I've learned. The biggest danger isn't the number itself. It's that almost nobody patients, or even some doctors, is reading it the right way. Let me give you a number that should get your attention. Nearly half of all American adults have high blood pressure. But once you're past 60, that number jumps to over 70%. That means 7 out of 10 people your age are walking around with blood pressure that's classified as elevated or high. Here's what almost nobody tells you, though. Decades of heart research show that your risk for heart attack and stroke doesn't suddenly switch on at some magic number. It climbs slowly, steadily, starting way earlier than most people realize. So the real question isn't, is my blood pressure too high? The question that actually matters, the one that determines whether you stay healthy and independent, is too high for whom? Under what circumstances? And compared to what? That's exactly what we're covering today. And by the time we're done, you'll understand your own numbers better than most people ever get explained to them in a doctor's office. Before we dive in, let me tell you a little about who's talking to you. I'm Dr. Leon, and I've spent the last 20+ years focused specifically on heart health and blood pressure in adults over 60. I've sat with thousands of patients, people who walked in confused, scared, or downright frustrated. One doctor tells them their numbers are fine. Another tells them they need more medication. Some are over-medicated and dizzy. Others are under-medicated and heading toward a stroke without any idea it's coming. None of that confusion is your fault. The guidelines have changed multiple times over the years. What used to be considered safe 20 years ago is now considered risky, and the way most people check their blood pressure at home, it's often giving them numbers that simply aren't accurate. Today, we're going to clear all of that up together. I'll walk you through which numbers genuinely matter after 60, based on the largest blood pressure studies ever done. I'll show you a hidden number one you can calculate yourself in 5 seconds that predicts heart attack and stroke risk better than either of your two main numbers alone. And I'll show you the everyday measuring mistakes that are giving millions of Americans false readings, leading to medication they don't need, or, worse, false peace of mind when they actually need help. Now, this channel is just getting started, and I'd love your support. If today's video helps you, hitting that subscribe button takes 2 seconds and costs nothing, but it helps us reach more people just like you who need this information. So, go ahead and hit subscribe now. Let's start with something almost everyone gets wrong from the very beginning. Your blood pressure reading has 2 numbers. Most people only really pay attention to one of them. That right there is mistake number 1, and I've seen it lead to outcomes that could have been completely avoided. So let's break down what these 2 numbers actually mean, because once this clicks, everything else about blood pressure will start making sense. The top number is your systolic pressure. This is the force of your blood pushing against your artery walls the moment your heart beats when it squeezes. Picture a wave crashing against a seawall. Every heartbeat is another wave hitting that wall. The bottom number is your diastolic pressure. This is the pressure in your arteries between heartbeats, when your heart relaxes. Think of it as the tide level when the waves pull back the steady background pressure your blood vessels feel all day, every day. Both numbers matter. But after 60, they don't matter equally, and understanding why is one of the most useful things you'll learn today. As we get older, our arteries naturally get stiffer. They lose some of their flexibility. And when your arteries are stiffer, each heartbeat's wave hits harder, because the artery can't stretch and absorb the impact the way it used to. That's why the top number, systolic, tends to creep up with age. It's not always a disease. Sometimes, it's simply the natural physics of aging blood vessels. But here's the twist. The bottom number often does the opposite. As arteries stiffen, they don't bounce back as well between beats, so diastolic pressure often stays the same or even drops after 60. This creates a pattern that's incredibly common after 60, but rarely explained to patients. It's called isolated systolic hypertension, where your top number is high, but your bottom number is normal or even low. This is actually the most common type of high blood pressure in older adults. Now here's where things get confusing, and frankly, a little dangerous. For decades, doctors followed a simple formula. Your normal systolic pressure should be 100 plus your age. So if you were 70, a reading of 170 was considered totally fine. That rule was wrong, and it cost lives. We now know that a sustained systolic reading of 170 inches, a 70-year-old, significantly raises the risk of stroke, heart failure, kidney damage, and even memory decline. That old formula gave millions of people false reassurance while their bodies were quietly being damaged year after year. But then, the pendulum swung too far the other way. Back in 2017, guidelines lowered the official cutoff for high blood pressure to 130/80. Overnight, millions of people who were previously considered normal were suddenly reclassified as having high blood pressure, including many people over 60 who felt completely fine. Many were started on medications they may not have actually needed. So, what's the real answer? What's genuinely too high after 60? The most important research on this is what's known as the SPRINT trial, a massive study published in 2015 involving over 9,300 participants. It's the largest, most rigorous blood pressure study ever conducted. What they found was striking. Aiming for a systolic pressure below 120 reduced the risk of heart attack, stroke, and cardiovascular death by 25% compared to the older target of below 140. And for people over 75 specifically, the benefit was even bigger, a 33% drop in cardiovascular events. And for someone over 60, a bad fall caused by blood pressure medication that's too strong can be just as dangerous as the blood pressure itself. So here's the bottom line. There's no single number that's too high for everyone. The right target depends on your age, your overall health, your personal risk factors, and your history. But I can give you the ranges that the research supports. And once I lay those out, I'm going to show you that hidden third number I mentioned, the one most doctors never even calculate. Once you see it, you'll wonder why nobody explained it to you sooner. Here's what the research tells us. For adults age 60 to 75, a systolic reading below 130 at rest is ideal. 130 to 139 is acceptable if you're feeling well. 140 to 149 means it's time to monitor closely and consider lifestyle changes. And 150 or higher, consistently, at rest that's too high and needs attention. For adults over 75, below 140 is generally the goal. 140 to 149 depends on how you're feeling and your personal risk of falls. 150 or higher, consistently, is too high regardless of age. For the bottom number, diastolic. Below 80 is ideal. 80 to 89 is worth keeping an eye on. 90 or above, consistently, puts real strain on your arteries and organs. Now, the number I promised you. This is a number you can calculate from any blood pressure reading in 5 seconds, and research shows it actually predicts heart attack and stroke risk more accurately than either of your two main numbers alone, especially after 60. It's called pulse pressure. Pulse pressure is simply the difference between your top and bottom numbers. If your reading is 150/70, your pulse pressure is 80. If it's 130/80, your pulse pressure is 50. Why does this matter so much? Because pulse pressure is a direct measure of how stiff your arteries have become. Stiffer arteries push the top number higher and let the bottom number drop lower, and that widening gap is one of the clearest warning signs of cardiovascular risk in older adults. A landmark study using long-term heart health data found that pulse pressure was actually a stronger predictor of cardiovascular trouble than either the top or bottom number alone in people over 60. Here's how to read it. Below 40 is normal. 40 to 60 is acceptable, but worth keeping an eye on. Above 60 is a warning sign of significant arterial stiffness and elevated cardiovascular risk. So, if your reading is 160 over 70, most people would just focus on that 160. But your pulse pressure is 90, and that's a major signal that your arteries have lost a lot of their flexibility and your heart is working overtime. Now, here's something almost nobody talks about, and it's just as important as a number being too high. A bottom number that's too low. In adults over 60, a diastolic reading consistently below 60 can actually be dangerous. Research has found that when the bottom number drops too low, the pressure between heartbeats may not be enough to properly supply blood to the heart muscle itself. Let me tell you about a patient I'll call Walter, 4 years old, a retired mechanic. He was on 3 blood pressure medications. His top number was well controlled at 128, but his bottom number had dropped to 52. He was dizzy every time he stood up and had already fallen twice in 1 month. Walter wasn't having strokes. He was over-medicated. His diastolic pressure had been pushed so low that his heart wasn't getting enough blood between beats. We carefully reduced one of his medications, and within 3 weeks, his diastolic rose to 68. The dizziness stopped, the falls stopped, and his blood pressure remained well controlled. His previous doctor had been so focused on the top number that nobody had noticed the bottom one had dropped to a dangerous level. So here's your takeaway. Don't just watch the top number, and don't just watch the bottom number. Calculate the gap between them, and make sure your bottom number hasn't dropped below 60. Too low can be just as risky as too high. I'd love to know, do you know your blood pressure right now? Not from your last appointment, but right now? Have you ever calculated your pulse pressure before? Drop it in the comments. I read every single one. Now let's talk about something that's quietly affecting millions of readings across the country, and it could be the difference between an accurate diagnosis and a completely wrong one. These aren't small mistakes. They can add 10, 20, even 30 points to your reading. And that gap could mean the difference between walking out reassured or walking out with a prescription you didn't actually need. Mistake 1. Not resting first. You walk into the doctor's office, check in, walk down the hallway, sit down, and within a minute, your blood pressure is taken. That reading is almost certainly inflated. Research shows that taking blood pressure without 5 minutes of rest first can add 10 to 15 points to your systolic number. That's the difference between 138 and 148 between acceptable and too high. Mistake 2. Talking during the reading. Studies show that talking while your blood pressure is being measured can raise your systolic number by another 10 to 15 points. The nurse asks how you're doing. You answer, and your reading jumps. Nobody connects the dots. Mistake 3. Crossing your legs. Believe it or not, this can raise your systolic reading by 5 to 8 points. Stack that on top of no rest and talking, and you could be 25 to 35 points above your true number, which could lead to a completely different diagnosis based on a completely wrong reading. Mistake 4. Wrong arm or wrong cuff size. Blood pressure can genuinely differ between your two arms by 5 to 10 points. If you only ever measure one arm, you're getting a skewed picture. And a cuff that's too small for your arm can artificially inflate your reading, something that's almost never checked. Mistake 5. White coat hypertension. This is when your blood pressure rises in a medical setting because of anxiety you might not even consciously notice. Your body reacts automatically, heart rate goes up, adrenaline kicks in, and your pressure spikes. Research suggests this affects 15 to 30% of people diagnosed with high blood pressure. That means up to 1 in 3 people being treated for high blood pressure may not actually have it. Their pressure is only elevated when someone in a white coat is measuring it. This is exactly why measuring at home and doing it correctly matters so much. Here's the protocol I recommend to every patient over 60. Sit quietly for 5 full minutes. Feet flat on the floor. Back supported. Arm resting at heart level. Make sure your bladder is empty. No talking. No phone. No TV. Take 2 readings, 1 minute apart, and use the lower number. Write it down. Do this twice a day, once within 20 minutes of waking up, before coffee or breakfast, and once before bed. Alternate arms every other day. Do this for 7 days straight, that's 28 readings total. Then average all 28 numbers together. That average is your true resting blood pressure, not a single office reading, not a number after rushing across a parking lot. That's your real baseline. If that average is consistently above 150 systolic or 90 diastolic, it's too high and needs attention. If it's between 130 and 149, bring those 28 numbers to your doctor. They're worth far more than any single in-office reading. Now for one of the most important things we'll cover today. The question I hear constantly from people over 60. When does high blood pressure become a true emergency? When should you call 911 versus simply monitoring at home? What warning signs mean a high reading could become life-threatening within hours? Here's something most people don't realize. A high number, even a very high number, isn't automatically an emergency on its own. I know that might sound surprising, but let me explain. Say you check your blood pressure at home and see 170 over 95. Your first instinct might be to panic and call 911. And sometimes, that's exactly the right call. But often, that's just a temporary spike from stress, pain, caffeine, or even anxiety about the reading itself. So how do you tell the difference between a spike and a true emergency? The answer is symptoms. A high number without symptoms is a signal to monitor. A high number with symptoms is a signal to act immediately. If your blood pressure is above 180 systolic or above 120 diastolic, and you're experiencing any of the following, call 911 right away. A sudden, severe headache unlike anything you've felt before. Chest pain or tightness. New or worsening shortness of breath. Vision changes, blurring or partial loss. Difficulty speaking or sudden confusion. Numbness or weakness on one side of your body. These symptoms indicate what's called a hypertensive crisis, where blood pressure is actively damaging organs like your brain, heart, kidneys, or eyes in real time. Studies show that an untreated hypertensive crisis carries a mortality risk of up to 25% within the first year. That's 1 in 4. But here's the flip side. If your reading is 170 over 95 and you feel completely fine, no headache, no chest pain, no vision changes, that's not an emergency. That's what we'd call an urgency. There's a real medical difference. In that case, sit down, rest for 5 minutes, breathe slowly, and retake your reading. In most cases, the number will drop 15 to 25 points within 10 minutes. If it stays elevated after resting, contact your doctor that day or first thing the next morning. Let me tell you about a patient I'll call Dorothy, 8 years old, a retired school secretary. She called my office in a complete panic. Her home monitor read 182 over 98, and she was already putting her shoes on to drive to the ER. I asked her 3 quick questions. Headache? No. Chest pain? No. Vision changes? No. I told her to sit down, put her feet up, close her eyes, and breathe slowly for 10 minutes, then retake her reading. She called back 12 minutes later. Her reading was now 148 over 84, still elevated, but no longer in crisis territory. As it turned out, that first reading came right after a heated phone argument with her sister. Her body had flooded with adrenaline. Her true blood pressure was never 182. Her reactive blood pressure was 182. Dorothy didn't need the ER. She needed 10 minutes and a deep breath. Here's the lesson. We don't treat single spikes, we treat patterns. 1 high reading is a data point. 2 weeks of high readings is a pattern. Know the difference. But also know when to act. If your reading is above 180 over 120 and you have any of those warning symptoms, don't wait. Don't rest and recheck. Call 911. That's a genuine emergency, and minutes matter. Let's pull everything together. My goal is for you to leave this video not confused, but with clarity. Not afraid, but in control. Here's what you now know that most people your age don't. Your blood pressure has 2 numbers. The top systolic /2 measures the force, when your heart beats, and the bottom diastolic measures the pressure between beats. After 60, the top number tends to matter most because arterial stiffness pushes it higher. But if the bottom number drops below 60, that's a warning sign most doctors miss. And now, you know to watch for it. You know the target ranges. For ages 60 to 75, systolic below 130 is ideal, 130, 139 is acceptable, 140, 149 needs monitoring, and 150 or above consistently is too high. For those over 75, below 140 is the goal, and 150 plus consistently is too high, regardless of age. And a diastolic of 90 or above consistently is too high at any age. You know about pulse pressure, the hidden number most doctors never calculate. It's your top number minus your bottom number. Below 40 is normal, and above 60 is a warning sign of significant arterial stiffness and increased cardiovascular risk. You can calculate it in 5 seconds from any reading. You know that blood pressure naturally moves throughout the day, rising with stress, movement, pain, or caffeine, and falling with rest and calm breathing. A single high reading is not a diagnosis. A consistent pattern is. We treat patterns, not spikes, and that one distinction alone could save you from years of medication you didn't actually need. You know the 5 common measurement mistakes that can falsely inflate readings by 25 to 35 points. Skipping rest before measuring. Talking during the reading, crossing your legs, using the wrong arm or cuff size, and white coat hypertension, which affects up to 1 in 3 people diagnosed with high blood pressure. You know the correct way to measure? 5 minutes of quiet rest, feet flat, back supported, arm at heart level, 2 readings 1 minute apart, twice daily for 7 days. Average those 28 readings, that's your true baseline, and it's worth more than any single office reading. And you know the difference between a spike and an emergency. A high number without symptoms means rest, monitor, and recheck. A reading above 180 over 120 with severe headache, chest pain, vision changes, or one-sided weakness means call 911 immediately, because in a hypertensive crisis, minutes matter. After all these years in practice, I can tell you the biggest problem I see isn't blood pressure being too high. It's people not understanding their own numbers, people afraid of readings they can't interpret, people over-medicated because of inaccurate office readings, people under-medicated because their true pressure was never properly measured. Understanding your numbers doesn't create fear, it creates power. The power to ask the right questions, measure correctly, and know when to act and when to simply breathe. So here's what I'd love for you to do. Tonight, take your blood pressure using the protocol I just walked you through. Calculate your pulse pressure. Then head to the comments and share your numbers. I read every single one, and if you have questions, I'm here to help. If this video gave you some real clarity today, here's how you can help us out. Hit that subscribe button, give this video a like, so YouTube knows to share it with more people who need it, and pass it along to someone over 60 inches your life who's been worried about their blood pressure numbers. You might just give them the understanding that changes everything for them. Blood pressure isn't a mystery, and it's not a sentence, it's a signal. And now, you know exactly how to read it. I'm Dr. Leon. Take care of your heart because everything else depends on it. This video is for educational purposes only and does not constitute medical advice. Please consult your physician before making any changes to your medications or health routine.